All right, so I am excited to be here today with Mr. Brian Johnson, and we're going to be talking about the future of healthcare. So Brian, tell us a little bit about the work that you've been doing as a futurist in this space.
Well, why don't I start with this, Michael? So what I do as a futurist is I look 10 years out and I work with individuals and organizations to model both positive and negative futures. And then I'm really an applied futurist. So what I then do is say, okay, well, what do we need to do today, tomorrow, 5 years from now to move towards that positive future and away from the negative?
Yeah.
Probably the best example where I've done this in the past is I was the chief futurist at the Intel Corporation, the chip company. And really, they are, it takes them 10 years to design, develop, and deploy a chip. And so it was kind of my job, and it was vitally important that they knew what people would want to do with technology 10 years in the future. So that's what I did. So I used this interdisciplinary approach called future casting and threat casting, which we'll dive into, to kind of see how will people want to act and interact with technology. And then I wrote a spec. So I'm an engineer and a designer. So as we're talking today, my nerd is going to show a lot.
Good, I love it.
That is my background. I'm a complete nerd. I'm a technological futurist as well. So that's my bias, is that's the world that I know and the world that I come from. And so and I would write a spec and say, this is what the technology needs to do 10 years in the future. But actually, organizationally, and I think this is where it starts to intersect with our conversation today, organizationally, for the past 25 years, we've begun to see, well, once you have a vision for this possible potential future, whether it be positive or negative, you can use it not only to build things, but you can use it to do planning. You can use it to do participatory design. You can use it to do community involvement. You can use it to do sort of broader ecosystem building. And one of the things that we would use it for is getting an understanding of, number one, what are the capabilities that an organization might need? Or more specifically, what are the people? Who are the people that we might need? What might that look like? And not only in my case, when I was at Intel, it was what engineers did we need, or what people, or what behavioral economists, or what have you. And oftentimes we would say, oh, we need these data scientists. Well, great. These data scientists don't exist. And so we need to go to the universities and start getting the universities to make those data scientists so we can go and do that. So that's kind of what also brought me into the world of academia as well, as actually working first with University of Washington, then CalArts, and now ASU, kind of figuring out, okay, what are the capabilities that we might be needing for the future? And then how do we start training people to start thinking about this and start being a little bit different and sort of how we think about the future. So that's how I look at things. I'm very much in that way. I think that is my bias as I come in, because I am very definitely a hammer, and these things look like nails to me. So it's because that I've been a hammer for 25 years. And so that is my, so when I think about the future of healthcare, when I think about the future of healthcare systems, generally it is through that technological lens, and then through that lens of both future casting and threat casting.
Yeah.
Does that make sense?
It does make sense. Why don't we start there with future casting and threat casting?
So yeah. So future casting. So both of these are kind of nested under this idea of applied futures methodology. So it's this kind of, and the idea here is to say that one, future casting is generative. That's the difference. Is you say, I want to make this future. And what you do is it's a methodology that is fiercely interdisciplinary, and both of them are. It starts with social science. So it says you're going to be modeling the future. And by the way, the future is all about people. This is, I think, also why it's relevant to healthcare. It's all about people. So it starts with people and it ends with people. And there's a lot of technology. There's a lot of processes and procedures and companies and organizations, but it's always about people. And so we need to start with a scientific understanding of people. Ethnographic understanding of people, so that we can then figure out how do we make their lives better. And then next we look at technology, what will technologically be possible 10 years from now. And then what we generally say is, well, then how would you use that technology to make the lives of those people better? And of course, better is a massive quotes, right? Better for who, better for how, let's do who gets to define better. Yes, all those
Right.
things, yes. But and we and when I teach this, we, again, as you saw, I was initially always talking about my bias. This is one of the things we do in the lab, to say, well, this is who I am, this is my background, this is what I am trained in, this is my bias, this is, so you, and oftentimes we, as we're going through and doing a lot of this modeling, kind of say, okay, we know that this is where we're coming from and also what we're missing. And so we'll talk about that in a minute when we do the participatory design. So we do that, we do technology, how do we make their lives better? Next, say, cultural history. So also understanding that cultural history and history is incredibly important when it comes to this, and certainly when it comes to healthcare, and really for most things that have to do with people. And there's two parts of that. One is understanding the cultural history of the sector, the market, the thing. But the other is also, if you're in an organization, so this being an applied futures method, you are not only modeling possible and potential futures and say, how do you bring those about, but you actually ask, who are you doing it for and how will they use it? This is really, really important, and really a big difference in the kind of foresight work that I do in thinking about the future, because it's very specific. You really are doing it for somebody so they can then go do something for it, whether it be in my private practice when I do it with companies, or say when we're doing it in my threat casting lab, we're sort of, and where it's much, much broader, but we have to get really specific. I like to tell people that the historians that I do work with, they say that history doesn't repeat itself. It's just the language we use to talk about the future. And that's why I think that history part is so important. We also look at economics. We look at trend data, so regulatory trends, cultural trends, and then we do subject matter expert interviews. So all of that, Michael, kind of goes into saying, all right, well, then we do a participatory design with people to then help design that future and think about that range of possible and potential futures and say, okay, and it's really an effects-based approach. It's an effects-based model. So like if we were doing a product or you're doing a service, you don't describe the product or service, you describe the effect you want it to have. This is also why I think it's important to healthcare when it comes to healthcare, because you understand, well, what are we trying to get done? And then you begin, again, my engineer is showing you then begin to reverse engineer it to say, okay, well, what do we need to do to make that happen? It's a mix of experience design methodologies. And then from the military, it's called effects-based operations, which is, okay, I want to get to this, I want to take that hill. What do I do? So how many tanks, what do I do? So it's based in that type of idea that every operation sort of is a complex problem that you're going to need many different things to do. And then for future casting, then you backcast and say, okay, if this is where we want to be, this is the thing we want to build. Well, what do we need to get done 8 years from now? So what do we need to do to get there? Who do we need to partner with? What do we need to build? What research needs to be done? And then we cut it in half again and say, well, 4 years from now, what do we need to do? Where do we need to be? So you're doing a little bit of this sort of iterative design. And then you're also beginning to find, well, what are the indicators that you are moving towards that future? What are the things that are outside of your control that are showing that you're actually moving towards that future? The example that I can give you that we would use at the Intel Corporation all the time would be flexible glass. We knew that people would totally love to have, all these things be completely flexible and bendable. We had the chips and we had the communications, but we just didn't have the glass because it's science. And so we would go to my friends up at Corning twice a year and say, okay, are we close? Are we getting closer? Because the moment they said, yes, we have it, then we knew the steps that we could go and take. That's future casting in 5 minutes.
Yeah, absolutely.
Make sense?
It does absolutely make sense. And so that being said, you talk about, this idea of future casting being based on an intention that we're putting into the future and moving into. And so when it comes to healthcare and you're seeing, what is being future casted, or there's this intentionality that's being put out there, what are you seeing, in say the next 10 years? Because I know that's the range that you like to work in, that 10-year range.
I do, yeah. Yeah, so for me, so much of for me is about, certainly the problem of the now is we're in a global pandemic. So that is and I've been doing actually a lot of work in the sort of threat casting, looking at the next 3, 6, 12 months, 2 years of what that looks like, and applying it very specifically to come up with a framework for policymakers, leaders, to make decisions about what to do. And certainly happy to talk about that work. We've been doing it for about a year.
Yeah, that's good work.
It's interesting. it's a global pandemic, so it's hard, but yeah, it's been interesting, and that's been an interesting ride. But to answer your question, so 10 years out, I mean, so much of what I'm doing is sort of twofold. One is looking at technology. So we do know, as we look, out, we're going to have a constellation of technologies. It's not just one technology. That's one of the things that I keep pushing, is that yes, we're going to have artificial intelligence, and it's going to be really important, but also we're going to have autonomy in land, sea, and air, and we're going to have computational power wherever we need it, and we're going to have increasingly use of robotics, and we're going to have the Internet of Things and wearables, as well as smart cities. And all of these things together actually begin to create an environment which we can really begin to optimize our environment. And I think a great example when it comes to healthcare is you can say, well, how do we treat? You can actually begin to have buildings that can help treat people. You can actually have spaces and places that actually are helping to track and monitor. And again, we have to be very wary and cognizant of privacy. But an example that I use with my students all the time is, imagine working in what we would call a sentient building, right? So this would be a building that is, or living in a sentient building that is, number one, aware. Number two, it can think. And number three, it's social. It knows you as an individual, and it knows everybody in your family, and it knows people that you're around and working with. So when you come into a building, it knows you. And so we can begin to optimize all of these systems to actively care for people. And now you can begin to think about that. You can use it for optimizing things for work, for productivity. But I think it becomes really interesting when we start optimizing hospitals, when we start optimizing our homes, and we start optimizing our homes for healthcare, and especially elder care. Because oftentimes when we're doing modeling, we're looking at the most vulnerable, so the very young and the very old, and saying, all right, so how do we use all of this technology, again, because it's all about people, to optimize those spaces for the well-being and the welfare of those people, but then continuing to use that participatory design so that they are also a part of that. They are a part of helping these systems, because I think a lot of the times these systems right now are designed over there and brought over here, and then we use them. And I think we'll have the ability that simply by living with these and acting and interacting inside of these spaces, that you can actually program it simply by living in it and actually making it more optimized and better for you.
It's interesting you bring it up, because I know that I've been downtown to some of the buildings at the ASU campus, and I know that a lot of these buildings they're making an effort to start making some of those buildings kind of intelligent with your card and so forth. And I would imagine when you look at hospitals, and I guess that's one element of this, like so much of healthcare is like beyond the hospital. That's kind of like the last place you go. But specifically, I guess in this particular moment, if we take a moment to kind of just look at hospitals and look at maybe the treatment of, say, chronic disease and so forth, what are some possibilities that you might see in terms of the building potentially communicating with an individual in that type of situation, or a doctor or nurse?
And I think, yeah, I mean, it's beginning, because I think in hospitals, I mean, I like that we brought that up, because hospitals are really specific. And I think, so much of healthcare, as you say, I completely agree with you, in the future is going to be outside the hospital. And because that's where we want it, right? I mean, you don't want to find yourself, nobody wants to find themselves in a hospital. Definitely today during a global pandemic, you don't want to, but you never want to be in a hospital, right? So, and that's okay. But then, but if we can actually start pulling out, right, because there's the sort of emergency room hospital and sort of the hospital part of hospitals, but then there's also just the extended care and the outpatient care and a lot of that stuff. And if we can start pushing that out for myself, as I approach these and you start looking at sentient tools, you start thinking about, well, there's all these different tasks that can be optimized. And that's one of the things that hospitals and certainly a lot of healthcare systems are sometimes good at, sometimes not so good at, of being able to sort of optimize these spaces and places for all the different people that are there. And because it is so chaotic, that if you could begin to say, well, what if we also have all these technologies that are there and have the ability to act and interact with us at a human level? Because I think this is one of the things that's a big shift is, right now, the way that we act and interact with our devices is we use the QWERTY keyboard. So we use our keyboard. I think everybody knows, right? The QWERTY keyboard was designed to slow human beings down. It was designed so that when you used it on a typewriter, so that the arms didn't get all hung up, so that you actually have to type slower. So this is designed to make us more like a machine and to slow us down as human beings. And to me, it's really nuts that you actually have this legacy of something that was really designed actually back in the industrial age. And we still use this to act and interact with these amazing devices. Now, wind that forward 10 years, and we're now interacting with artificial intelligence, and that we can begin to think about, well, imagine having speech, imagine having gesture, and not just gesture like, sci-fi Minority Report gesture, just it physically is seeing you in the space and physically kind of understanding what you're doing. And then when you start to add to that, you can start to have predictive analytics, where you actually start to have the spaces themselves being able to kind of understand what's going on, especially in a hospital environment. But then living in those as well, you'll have these, every device that you would want to have some sort of ability to sense and some sort of the ability to know, to sense and communicate that it could. So you can even think about, right, having a smart bed. Well, a smart bed makes a lot of sense. For a lot of times when people want to have fun, they talk about smart toilets, but there's a lot of really well-written, peer-reviewed things that it's actually really smart. Like if you could get a smart toilet, it can do a lot of stuff. So thinking about where to put intelligence so that, again, it's being able to monitor and give situation awareness, that then it's going back to that doctor, that nurse practitioner, keeping that person in the loop. I think in that, if you just start to wind that out, there's so much good that can come from that. Especially when it comes to the treatments that you're talking about. And then when those treatments then go out, when you're doing that sort of longer term care, then you can actually, that space and that intelligence just can move with you to your home. It can move to your car. It can move to your city as well.
Oh, that's interesting. So one of the things that you touched on earlier, you talked about how healthcare of the future is outside of the hospital. And I think that's a very, very, very important thing to bring up. And so as you kind of look at maybe some of these technologies that you see coming on board, maybe what are some of the things that you're seeing just maybe within the community, and then also in the home, that is going to maybe provide some type of prediction of health or wellness or well-being, maybe some things we kind of need to keep an eye out for? That'd be cool.
Yeah, let's wind it backwards. Let's start at the very personal level and then move out to the community, because I actually think that from a community standpoint, we've not done enough thinking about this. But so the other things I think we have. So let's do the easier stuff first and then actually do it open-ended. So from a personal standpoint, so imagine you have all the intelligence that you need, right? The ability to compute, not intelligence, not human intelligence. Put that aside. So when I talk about artificial intelligence, or when I say the word computational intelligence, what I'm talking about is industrial AI. It's just, it does work. It's not trying to be smarter than human. It's not all that sci-fi stuff, although I am a sci-fi author. It's not that. And that's an interesting conversation to have. It's an ethical and a legal and a philosophical conversation to have, but we're not having that conversation. We're actually just talking about, from an engineering mindset, this is intelligence that can just do work. So now we have all this intelligence, whether it be in our devices, in our cities, in our homes. Well, imagine being able to have situational awareness of yourself and of your body. And I don't mean in a really creepy way. I simply mean in a way of being able to monitor constantly sort of what's going on. And you begin to see some studies that are being done, whereas if you have the ability to monitor and have situational awareness of, say, of your heart, and you start to develop a heart irregularity, that from a predictive analytics standpoint and intelligence standpoint, that it could be possible to be able to spot a heart attack days, weeks, months before it ever happened. So that level of situation awareness, this level of situation awareness when it comes to blood glucose, right? So are you showing the beginning signs of diabetes, right? So how do we then take action around that?
So this is predictive. This is predictive insight. That's interesting.
And it's the idea of being able to say, and doctors have this, right? We have this knowledge, right? We know those indicators when it comes to your blood work. But the thing is, and this is probably a good thing, you don't have a doctor sitting there with you all the time, because that'd be kind of creepy. But actually then having these devices that have been a little bit more normalized into our lives, where so going back to that notion of sentient tools, where these devices are social, right? And that artificial intelligence is social. It knows you. It knows if you're an introvert or an extrovert. It knows if you're a morning person, right? It knows if you're really tired, right? So you start to develop this relationship, and not a human relationship, but just a relationship that you start to have. Now you can begin to see how you can start doing some behavior change, right? Where you can actually start to, and also just at a very simple level, taking your medication on time. Right. This is also one of the things that, when I talk to doctors and they talk about healthcare, this is one a huge problem, right? And especially with our aging population, that, so imagine that these spaces are caring for us at this very, very high level, just reminding us to take our medication, but also down even to the body level, where they're constantly kind of monitoring us and taking care of us, because we know as if we can spot these early, there's real benefit. Because it actually costs less to do preventative medicine and predictive medicine than it does to find yourself in a hospital. So I think that's an interesting way. And now you can actually go into the home, and that we go back out to saying, for the most vulnerable, for our very young and our very old, this becomes, I think, another tool, because they do need help, right? So there's folks like yourself and myself. We're good, we're functioning, we're out there, we're productive, we're doing stuff. But as you begin to see, and I think the pandemic has really shown us this in some of the cracks in that system of that ecosystem of support, being able to actually have more technologies, again, not replacing human beings, but more technologies in aid of human beings to take care of people, and to start designing our spaces to take care of people. And you can begin to think of it with our elderly, but now you can start to think of it from even broader populations when it comes to well-being.
Yeah. It's interesting as you talk about this. One of the things that comes to my mind is as I'm seeing like these types of environments, like you mentioned, that are sensing us, and they're kind of like this, almost like we're even whether it's like intelligent clothes that we wear, or devices that we wear, but there's this almost kind of like this Fitbit experience with predictive indicators that could provide insight about your well-being, your health. And then the next thing that comes to my mind with a question like this is the role of insurance in all of this. That's the next question.
Well, I think so much of what insurance, right, is risk. So insurance is about risk, and saying, okay, so what gets paid, what doesn't get paid, how do we keep people out? So this is one of the things I think that predictive modeling can really help with, is you don't want to find yourself in the emergency room. You don't want to find yourself in a hospital. Really, it'd be great if you didn't find yourself in the doctor's office, right? And so if you can actually sort of do that preventative and predictive, it's actually better for the insurance companies. It's actually better. So that's one of the things where if you actually see what's been going on, not in health insurance, and I'm not saying this is a one-to-one correlation, but you are starting to see a little bit of this in like in auto insurance, where you have devices that are monitoring your driving. Now, again, we have to be very careful when it comes to privacy. We have to be very careful when it comes to protecting people. But, if you drive, if you are really, really safe, I mean, you are doing all the things that you're supposed to do, that's actually really helpful. And so you can begin to say, all right, well, is there a way that we can, equitably move that over and say, okay, what are some steps that could be taken? And you can already see in some insurance plans where if they're encouraging preventative health, they're encouraging gym memberships, they're encouraging, and not only insurance companies, but also employers are doing some of that as well, where they're encouraging more healthy activity so that it is warding off some of those sort of ongoing conditions that you mentioned.
Yeah. Yeah, because, with the focus of this particular this research, it's targeted on the Black community, and I know that there are a number of disparities there clearly, and so when we start to talk about these future technologies and AI and AI, and I've even seen it, in the way that some of this technology has been built, it can be biased. And then in addition to that, there is, just if you're looking at insurance, you're looking at predictive modeling, you're looking at the insurance companies, they never want to pay money for anything, right?
Right.
So, it doesn't matter who you are. So, when you bring individuals who may have, because of a number of different inequities historically and present, I'm wondering, like, how this type of new technology is going to account for these types of variables.
I'm glad you asked about this. So number one, I want to be, and I know you said this, but I want to echo this and even support it more. All technology, all data is biased.
Yeah.
And this isn't a bad thing. It can be bad. It can be used for a bad thing, but go with me for a moment. So this is a shift that's, I think, happened in the past 5 years and especially in my world, sort of the world of engineering and design, where the idea, what people had said before, and I'm sure you know this, and your research and the work you've done, people were like, it's data. Data is not biased. It's like, no, data is completely biased. And
Yeah.
completely biased. And the systems that they're being used on are biased as well. But I want to take a step back, not saying because it's not biased, but I'm trying to use a different word to actually get people to understand what I mean and what I mean. So when I go to engineers and I say, what is the bias in your data? And they don't understand, right? So, okay, let me ask you a different question. What did you optimize for? When you were gathering that data, what were you optimizing for?
Mm-hmm.
You ask them that, they'll tell you this. Great, awesome. You have to do that because you can't solve all the problems for all the things, right? You just can't do all. You have to make a decision. And when you make those decisions, which we have to make those decisions to do anything, there's your bias. You've actually said, I am prioritizing this over that. Period.
Wow. Yeah.
And so then they go, oh, okay. And say, great, now that you've recognized that bias and that what you optimize for, now go find the counter to that. Now we can start countering that bias. Now we can start having that conversation. So that's one of the things that we do functionally, because I do think there's functional ways to do this, that you, in my lab, in my threat casting lab, from the very beginning as future modelers, we know that the more diverse and inclusive your inputs, the better the model that you come up with. We know this. Like economics, there are Nobel Prize winners who, if you don't agree with me, go talk to the Nobel Prize winner. We know it from biology. We know it from all that. So we know that we need a more inclusive sort of model as we pull these things together. So when we do this, we use math. I'm the engineer, right? So it is, from gender, from ethnicity, from domain expertise, from age. We're always trying to find those inputs. And so as a part of this applied futures methodology that I do, when we're doing that design work, and I want to come back because I think this is important to that community thing, that the community question that you had. I think that is incredibly important. But then what we do in the lab is we, number one, state our bias, right? We say this is, or what we know, at least what we know that to be, but then we're always trying to find who's not there. Who didn't we talk to? And it's something that I teach. It's called always looking for the outlier. So you can create a system and create a solution, which is great, but then you ask, who is the outlier? Like you always ask, well, who is this not serving? Because it can't serve everybody. And starting to really understand and recognize that and have that be a part of the design culture. And it's a part of the culture in my lab that you're always interrogating that. That again, if you find an outlier, if you find some bias, if you find somebody who we didn't interview or we didn't bring in, it's not bad. it's bad that we didn't do it, but it's a good thing because, you know, she or he who finds that first wins, because then you get to go talk to them. And so I think that from a, and this is just from, I think from a, for this type of work that I do and this type of kind of futuring work and research work, it's a type of culture that we're trying to foster, to kind of be actively interrogating that. So that goes back to your way around. So all data is sort of being biased. I've been trying to do some work early on in engineering programs to try to come up even with changing the nature of data itself so that you can go to it and say, who made you, who collected you, and why?
Wow.
So that you can, in that data itself, in the metadata about that data, it could say, okay, well, I was, you know, and it can really get down to it. So let's talk about sort of, you know, poor uses like, you know, algorithmic policing, right? So all of a sudden you can go, well, all this data set we know came from here, right? And we know, we've seen all the flaws, right? There's so much research done around the flaws around algorithmic policing because of the data sets being flawed. Okay, let's interrogate those data sets. Instead of having researchers do it, what if the data could do it itself? So I do think that that's a shift that I've actually seen starting to happen in engineering and some of these design parts, that is sort of embracing that fact that that's my long way around, Michael, saying all data is biased. Like it is, it's just, we just have to say it. That's number one. Number two, getting back to what you were saying, especially when it comes to healthcare, especially when it comes to communities of color. One of the big research projects that I was working on before the pandemic started was looking at artificial intelligence. And the question had been not the ethical use of artificial intelligence, but how do we use it? Because when I was talking to people about sort of ethical artificial intelligence, it's a wrong-headed way of thinking about it, because AI and technology is just a tool. It's just a tool. It's a hammer, like going back. It's just, that's all it is. It doesn't have the agency to be ethical. You want it to be ethically compliant. You want it to operate inside the ethics of your organization, your community, your culture, whatever, however, whatever you want it to be. Like a great example, I do work in my private practice talking to ethics, chief ethics officers at corporations. And I was like, you don't want an ethical AI, you want an AI that is ethically compliant to the rules and procedures and regulations that are governed by your company, so that this autonomous thing does not go off and do something that breaks the law. And so, and there's ways to train that. And I've actually written some things on that where we've done that before. We have trained human beings who, by the way, are autonomous agents who go off and do things. So you can actually take the processes and procedures of training people and actually use that same sort of ethics approach to using it on data and using it on these machines that might be taking action. So we've been looking at that, but in my long way around, I went and I started talking to activists. I started talking to people from the NAACP, to lawyers, to folks like that, say, well, what do we do? And really one of the findings that, that I've been working on and writing about is that, back to what you were saying, is I think it's dangerous to put the focus on AI. And it's dangerous to put the focus, even though I have just spent the last 35 minutes talking to you about technology. When we think about communities, it's dangerous to talk about the tools because it's just hammers. And what we've seen specifically when it comes to artificial intelligence, it is the existing power structures. It is the existing flaws in our power structures. They're just perpetuated by the tools. The tools only perpetuate those in power. And so that's part of it. As we start to think about it, the one researcher that I talked about is like, it's not about the AI, it's about the people, and it's about the inequities that already exist. The inequities are only going to be amplified. And that idea.
I think that's a very solid distinction. And, it's interesting because given this goes back to the policy piece that you were talking about a little earlier. So there's the policy piece you mentioned. You mentioned ethics. You also mentioned product development a little bit, and the creation of this technological future, with AI and other tools that we're creating. What are some maybe I'm almost hesitant to say jobs. That's not what I really want to say. But like, what are some strategic positions that people of color might want to consider taking in order to influence and impact this technology that we know is inherently biased?
So I think there's a couple of ways there. I think first is we just need more people of color who are engineers, period. I mean, and and when I say engineers, I'm a non-traditional engineer, and these systems are built by engineers, right? And these systems, and even an engineering way of thinking, I think is really helpful. And it's something that I've done a fair amount of work in. So that's the of trying to make sure that we do that. There's far too many engineers that look like me, and so trying to think about that. But then the other part is, and it goes back to, I think, even to what you're saying, Michael, which might be even broader, is what are the roles? What roles can people play? Because one of the things that I've been a big advocate for in a lot of the design teams, and when I say design teams right now, I just mean like in a company or in a startup, but I think we can extrapolate this out to something larger to get at what you're talking about. So in the design teams, before you would have a hardware person, a software person, right? It's just who builds it, right? But what I've been doing for the past 10 to 15 years is making sure that we have ethnographers and social scientists, that we have ethicists who actually sit on the team, right? Because, and this is going to start ringing true to you, it's who sits at that design table matters, right? Who is sitting there and who is contributing to the tool matters. There's one of the reports that's going to be coming out from our lab, looks at the notion of disability, whether it be physical, cognitive, you name it. And what would it be like to live in a post-disabled world? Like when the notion of disability doesn't exist anymore. And I think very similar, it goes back to what we were talking about, is who designs the tools and how the tools are designed really matters. And who's sitting at that table really, really matters. And so I think as we start getting into the sort of health systems, as we start getting into, it kind of goes back to that broader community piece that we're talking about, it is going and being a part of that process. And it doesn't mean you have to be an engineer. That having a say in that design process becomes really, really important. That we know then that those systems become more robust.
Yeah, you know, there's, I think the Project Management Institute has a course on, it's citizen development, I believe is the title that they use. And the sense that I get from it, I'm still trying to make sense of it all, but the sense that I get from it is that everyday people can contribute to design thinking and design processes. And so one of the things that I'm hearing in terms of engagement could be some type of infrastructure, organization, situation where people in the community could make themselves available to contributing their insights and their experiences to designing future technology, so that it's actually beneficial and helpful for them based on their lived experience, not what somebody else thinks that their experience might be.
Yes, I completely agree. And now I'm going to yes and you say yes for sure. And so go back to, again, my nerd technology world, right? Where you've got technology everywhere. Here's, I think, where it becomes really interesting when it comes to communities, because you're going to start having technology come into our cities, come into our communities, like come into with taxpayer dollars, right? With where it's no longer some Silicon Valley company anymore, right? It's smart parking meters, or it's smarter buildings, or you name it. And I think it becomes really interesting there, because just as you said, you can start getting people to say, and I think it's part of it is a mindset shift, right? So one of the things that I tell people is everybody needs to be an active participant in their future. Everybody has control over their future, some level of control. And we can talk about that. But because if you're not an active participant in your future, it means somebody else is designing their future for you.
Exactly.
And that never goes well.
Never.
And so And what I think could be interesting here, and I think what we're getting to, is a series of questions, just a series of things. Like you said, you don't have to be a system architect like myself. You can actually go in and say, really specifically around maybe a healthcare system, some artificial intelligence, any piece of technology, just say, well, who designed this? And what was it optimized for? Who was it designed for? I want to see that. Like, because in the design world, in the world of technology, there's requirements documents, there's documentation throughout this whole thing, and especially if it's being paid for by tax dollars.
Yeah. Yeah.
Like, to start asking those questions, because to me, if you start to me, one of those, I started asking that question: what was this optimized for? Like, and again, who is this not serving?
Hmm.
And if somebody says it's serving everybody, well, have them call me. I will tell them they're wrong. We know it's just not true. So actually starting to interrogate those systems, even if you don't even have to be an engineer to do that, right? It'd be if you were a healthcare worker, if you're a bus driver, if you're a community organizer, it doesn't matter, right? Everybody can ask those beginning sets of questions to then actually get at that outlier, get at what's not being served, get at those flaws.
Yeah, as we're talking about this, I'm really getting a sense of how important some type of organization or a committee or group or something that was organized and intentionally looking at, like you said, who was this product or the service optimized for, and really getting people to participate in this outlier research, if you will, in order to make the future more equitable.
And have that be a conversation, right? And so this is the
Yeah.
other part, right? That's hard, is that this is never solved.
Right.
Not in a bad way, not and not in a gloom. I'm an optimist, not in a doom and gloom way, but going, no, this is the work of living. This is the work of
Mhm.
design and of community and of all
Yeah.
that. It's just like, we just need to figure it out. Like, is everybody here? Okay, wait, who's not here? And then that idea, because I also think with technology, which is again my bias and background, you kind of, you make the device and you're done. Well, it's done. Well, no, it's not, right? That we know from a system standpoint, from a software standpoint, that it's never done. And so I think that having that, a culture that is asking these questions and always asking these questions, and that these are not bad questions to ask.
Mm-hmm.
These are not gotcha questions. These are questions to say, well, we are trying to make this solution better so that we are serving more people. This is not a bad thing, right? This is what we're trying to do.
Yeah. Well, and I think every company that delivers a product to the market or service to the market, I mean, ideally their objective is to delight the customer, or the end user in some way. And so if there is information that could be gathered that could improve that experience, not only would it be more profitable for the company that's building whatever it is that they're building, but it's also more beneficial in the end for the person who's actually being impacted or using the technology. So it's a win-win type of situation.
Yes. And I even think that mindset in and of itself can be empowering. It's one of the things that, for myself as a futurist, that I feel I can see that light go on in people's eyes when you start talking about that we all have the ability to build our future. And even, I mean, I've done work with I've done work with Syrian refugees. I've done work with people that everybody at some point, even at their worst, has the ability to have some control. And as you start to have this notion of that agency, that notion of being able to interrogate, when somebody comes to you with one of the most complex and delightful technologies, and somebody who is a chef, a cook, a bus driver, to be able to go and say, just like you and I said, well, who is this designed for? And who is it optimized for? And who designed this? And being able to ask those questions, and especially when it comes to things like healthcare systems, when it comes to more community-based ideas, that having that culture, like you said, having that culture of interrogation, I think is really important.
Yeah. Yeah. Wow. So we've covered a lot of ground here. So we started looking at, this whole idea of future casting, and we've tapped a little bit into not so much the details of the healthcare space, but really some of the things that are impacting that space. And then we really ended where I felt is a very solid place, and that is the human aspect of it, and humans contributing to intentionally creating future technologies, devices, and experiences, and having a collaborative approach to that. This has been a good journey.
It's a great conversation, Michael.
Yeah, absolutely. Brian, thank you so much for your time. And I'm going to stop our recording now.
Awesome.